The Department of Health is the principal health agency in the Philippines. It is actually with a very wide scope that we have placed upon their shoulders, and this involved but not limited to, in terms of responsibilities, making sure that health services, especially the basic ones, are accessible to everyone, down to the level of the barrios and the barangays, making sure that quality healthcare services is available to everyone, regulation of services including food and drugs and other necessary things that are related to health, as well as they are also a catalyst for whatever advocacies there may be related to health. Dynamic Living, the Total You, presents in the next 60 minutes our DOHR Health Vision for 2014. And I am very much honored to have with me here our division heads as well as representatives from the Department of Health. We'd like to thank them for sharing their time with us. I'd like to first introduce Dr. Cheryl Balane, Licensing and Regulatory Board. Good evening po, Dr. Cheryl.
Good evening, Doc. So I'm very happy that I am here in the Dynamic Living, and in behalf of our Director Concepcion, Aristides Concepcion Tan, I would like to thank you for inviting us because we have an opportunity to share to the public our programs and projects.
Opo, Dr. Cheryl, because as you can see, kapapasok lang ng 2014. And this is the best time actually for the people, our viewers, everybody out there, na what can they expect for 2014? Kasi, you know, health is very close to our hearts, di ba? And I'd like to welcome also Ms. Carmencita Lubguban from Non-Communicable Diseases. Good evening po, Ma'am Carmen.
Good evening po, Doc. I would like to thank you for inviting us and have the opportunity to be here with you to have a sort of some information regarding health, because according to you, health is the closest, should be the closest one to the heart. And we are so glad that we are given the opportunity for tonight. And I'm thanking the viewers also for the opportunity.
Yes, and of course, we'd like to welcome Ms. Cynthia Descallar from HRDU. Good evening po, Ma'am Cyn.
Okay, good evening, Doc, and good evening also to the televiewers of this program. I would like to welcome you all to listen to us. For us, representative of the Department of Health, we hope we can learn from us about what is Department of Health doing for our country.
Mahalaga talaga yun eh. Kasi sometimes people, you know, just think na walang ginagawa itong department na to. Hindi ba nila alam na heto yung pinakamabigat kung iisipin mo. Because what is wealth without health? What is our practices kung wala namang health, di ba?
Yeah.
So, we realize that the number one thing na we have to take care in our lifetime should be our health, di ba? So, let's start by asking you, ano ba talaga ang main role ng Department of Health in terms of building the nation?
Actually, as has been said in the opening, the Department of Health is not only the national leader for health but also as a model and advocates for excellence. So we really committed to guarantee our people that there would be accessible, equitable, and quality health care of all Filipinos, so that we would be a contributor to the improvement of the quality of life of all Filipinos. So if we have a healthy citizens, so we would have also healthy and productive nation.
Yeah, tama yun, ano? Ano man ang pwede natin gawin, we may strengthen our armies, we may strengthen infrastructure, we may strengthen all the other necessities, no, basics as well. Pero kung wala din ang health, paano na lang? Sino ang gagawa noon? So, in terms of giving quality healthcare services, what do you think would be the major concerns of the department? Kasi hetong atin syempre kasama nung task na binigay sa Department of Health, which you are part of, meron din kayong mga major concerns, di ba? Hindi naman po pwede na they ask you to provide all these services and yet kayo hanggang tagabigay lang. Meron din kayong mga concerns. What do you think would be these concerns na the viewers should be able to understand also?
So the main concern is there are so many
Actually,
in regards to aspects. But the pangkalusugang pangkalahatan,
Uh-huh.
this concern, this covers everything.
Yung Ma'am Carmen, let me interrupt you. Pag sinabi mong kalusugang pangkalahatan, di ba this is your goal for 2014? Is this your goal for 2014?
Probably that is our goal, one of our goals. So
Okay.
there are so many goals for the different programs of the Department of Health. And then our objective for this is that we have to at least the objective is that pangkalusugan pangkalahatan to every Filipinos.
So pag sinabi ninyong kalusugang pangkalahatan, kalusugan is actually health eh.
Yeah.
Pangkalahatan is actually nationwide.
Nationwide.
Ibig sabihin, it goes down to the grassroots level. So in other words, what you're trying to say, of course we know for a fact that maraming programs ang Department of Health, which you will be telling us mamaya. Then no, I'll be asking that. Pero the thing there is, kumbaga, your theme talaga for the entire year maybe would be that everything should be given down up to the level na hindi naaabot ng ordinaryong mamamayan.
Actually, the health now, no, since the local code of 1991 is already devolved to the local government unit. So now, our main task of the Department of Health is to assist the local government, or we are the servicer of the servicer. So we give service to the local government, who are really the implementing agencies.
So what you're saying, Dr. Cynthia, hindi na talaga directly from Department of Health. I mean, directly from Department of Health yung mga policies and programs, pero pagdating sa implementation nun, hindi sa inyo yun.
Hindi. Yun na ang problema. Kasi policy, mandates lahat, galing sa Department of Health. But as to implementation, nandoon na sa local government.
Kasi na-devolve siya
Na-devolve na.
noong 1991.
Oo.
Pero prior to that, kayo yun lahat, di ba, ang
Oo,
gumagawa
lahat. Directly
noon?
involved kami lahat.
So kung baga, masasabi natin na mula sa pagsaing, paghugas ng bigas, sa pagsaing hanggang sa pagpakain, kayo yon.
Ganon.
So mas maganda siguro yon. Ano? Okay. Now, pag sinabi ninyo, how many different divisions do you have in the Department of Health? Kasi pag sinabi ng Department of Health, isang division lang ba ito or napakarami ninyo?
Actually, kung we will be talking about the central office, marami talaga by bureau and by services. And these different bureaus in the central office is now turned into 3 at our level, regional. We have the local support division, we have the regulation and licensing, and the management support division.
Okay. So pag sinabi niyo po na tatlo kayo, sa local yan, we're talking about sa local, no? Region 10. Pag-usapan natin yung Region 10 lang kasi medyo malawak kung masyadong isali pa
central.
natin yung main office. Ano? So yung sa Region 10 lang, tatlo kayo. Merong
Tatlong
management, merong regulation and licensing, and local health support. Oo. So pag sinabi niyo pong local health support, unahin natin yan. Ano po ang ginagawa nito?
Actually, in the local health support division, we have 5 support to the local government. Number 1 is the logistics support in terms of the vaccines. We have also supplies, and then we have also the infrastructure and the equipment support to the local government, and of course, the other one is medicines.
Pero pag sinabi po ninyo sa management, ano naman ang ginagawa noon?
Doon sa amin yan. It's about budget.
Okay.
About budget.
So, money matters
allocation.
na sa inyo.
Money matters, management support.
Okay.
Then transportation, pag nangangailangan ng 2 division.
Sa inyo yun?
Sa amin yan.
So, paano naman pagdating naman dun sa, yung isa naman, yung sa licensing naman, regulation? Kanino naman yon? Sa iyo?
Actually, sa amin ang regulatory, kasi nasa licensing ako. So, yung mga hospitals, yung mga health centers, at saka food, drug, cosmetics.
Sa inyo yun?
Sa amin yun.
Kasama na yung mga pampapaganda dyan. At saka yung mga toys na sinasabi nila ng mga kabataan. So, sa inyo yun.
Kasama.
So, when you really look at it, napakalawak ng inyong scope. Diba? And would you say na heto naman, considering na dinivide kayo into different areas dito sa local natin, would you say na so far in your years of being with the Department of Health, in the different divisions that you are in, medyo okay naman yung integration ninyo for all of this para maging successful yung pagpatakbo ng mga policies ninyo?
Usually, mayroon talaga in a big organization, hindi talaga maiwasan na mayroon mga stress na challenges. But most of the time, ano naman kami, per achiever kami ng Region 10.
Which is actually, isa kayo yata sa top performing and congratulations to that. And we are very happy kasi syempre, kapag top performing ang ating local Department of Health, it translates to the services na the people here in this place or region are able to receive, no?
Yes.
At kasama kami dyan, no? So
Of
nagpapasalamat
course.
kayo and we'd like to congratulate you. So sabihin na natin, pag-usapan natin yung key thrusts ng Department of Health. Siyempre, bawat department, meron yan siyang kumbaga mapa ng kanyang gagawin for the year. Kaya nga nagsa-strategic planning, di ba? Bago nga lang tayo, 2014 nga lang So I'm very sure you also have that in you. So the first na alam ko na thrust ninyo is actually to increase the enrollment to PhilHealth-sponsored programs. Ano ba itong programs na ito?
Okay, actually, this is a big challenge from the present administration. That's why we have the Aquino Health Agenda. And then, what the Department of Health answered was the universal health care. And then with that, together with the different agencies like this WD, DepEd, and DOH, this WD made a national health survey, national NHTS, National Household Target Survey.
Okay.
And then where the Department of Health comes in, those identified by this WD will be for PhilHealth that will be enrolled and paid by the Department of Health.
So do you think, ma'am, na pag sinabi mo na ito ay sponsor ng PhilHealth, ang PhilHealth nito ay sponsor ng Department of Health.
Okay.
Depende siya kung sino yung i-recommend ng DSWD.
Oh, kasi ma'am, we divided the society into 5 quantiles.
Okay.
Yung quantile 1, which are very indigent, based sa survey ng this WD, those are paid by the Department of Health. What we enjoyed being employed and or maybe a
Self-employed or voluntary,
that could be enjoyed also by our indigent with the dependents. The same benefits.
Pero
they can
kasi nung
receive.
araw wala yan, di ba?
Yeah.
Parang hindi yan covered ng Department of Health.
Dito lang ngayon.
So ngayon, when did you start on this? For 2013 or
No.
or ngayong yes?
That started on 2010.
Pag-upo ni Pinoy.
Because of the Aquino Health Agenda.
Okay. And so far, what is the response here? Considering na 2010 man kaya yon, 2014 na tayo, so would you say na medyo marami-rami na kayong na-cover for PhilHealth?
Yeah. This is the data provided by the planning officer. As of September 2013, we have enrolled under in DOH a total of 284,000.
Marami-rami din yun.
Oo, and then for the KIPI, kakalsong pangkalahatan, we have 338,749.
So pag sinabi niyo po na kailangan i-enroll sila at ang DOH ang magbabayad, that is for life na enrollment nila or just pag-enroll lang sila, babayaran ng Department of Health, sakop siya ng Department of Health, but the continuance, di ba kasi merong binabayaran yan, continuity niyan. Sino na ngayon ang sasalo nun?
As of today, 2014 covered pa rin the DOH. And then, baka pagkatapos ng President Aquino's administration, I don't know
Depende
if the
na
next
kung anong
But as
nila.
the President is sitting in Malacanang, continue pa kami
Continue
ng bayad
siya
ng
ng
department.
bayad. And so indigents lang ang pwede nito. Nandun sa quantile na sinasabi ninyo, indigent.
Quantile 1. Yung quantile 1 is having the income of 3,004 below.
So ano po yun? Is it still open today? Can they still go to your offices? And or hindi na? Kasi tapos na yung ginawa ninyo.
Actually, there is an agency for that, the NHTS, who conducted survey during the early implementation, and then they are now validating because there are some who are in the list that have already
Kumbaga, meron
meron ng mga work ngayon, so they are updating every
Ano ang difference nito, ma'am, sa yung mga political sponsored PhilHealth ng DOH? Hindi ba iba ba ito or pareho lang sila? Who would like to answer this?
Actually, the PhilHealth supposed to be the quantile 1 and the quantile 2 would be shouldered by the Department of Health. And then those who are in the informal sector, like for the barbecue seller like that, they should be supposed to be shouldered by the
Local
government. But there are provinces or municipalities that they also enroll. So now there are those enrolled by the DOH, they are also enrolled by the province, and they are also enrolled. Others are also enrolled by the municipality.
Okay, so yun yung ano nun. But in terms of benefits, wala namang pagkakaiba, no? It's the same, no?
They will enjoy the same.
The same, no? Ang kanilang benefits. Please stay tuned. We'll take a very short break.
Usa ka tricycle driver nga mo duty og gabi usahay pod maadlaw. Usahay pod akong makuha sa pag-drive na kusikan kada adlaw. Gatos kapin 200 tungod kay dili man gud ko pud mo ilog sa ilag pasayro mo po nang igo-igo ra gid pud ang akong makuha. Nganhi ko diri kay aron sa pagtabang sa Hope Radio sa dayang akong nadunggan, akong gibalhin-balhin ang matag channel kining matag istasyonan sa FM. Ang ako lang, makahibalo lang ko kung unsa po'y kamatuoran bahin sa pag kinabuhi na itong malipayon nining kalibutan. Yung anhi ko aron sa paghatag og kinasing-kasing nga donasyon. Pero walay katudlo na ko niini kun dili ang kinasing-kasing og kini nga gihimo. Ako nalipay ko nga nakahatag ko sa operadyo bisan sa kinagamyan lang pod nga kuan matabang akong hatag ko og 50 pesos lang kada Biyernes o kada semana sa kausa sa kasemana sigon sa income nga akong maabot. Akong gibati ang usa ka dakong kalibay nga makatabang ako sa buluhaton sa Ginoo nga ang Ginoo makagiya usab siya sa iyang kahibalongan kanako. Dayon ako usab magadawat sa iyang kuan pinaagi sa maayong panimpalad ug pinaagi sa maayong dula sa kinabuhi.
Welcome back to Dynamic Living, the Total You, with our episode DOHR, Health Vision 2014, with our guests here, si Dr. Cynthia, Dr. Cheryl, Ma'am Cynthia, and Ma'am Carmencita. So, balikan nato, no? So, tapos na ta sa first thrust nato, which is to improve the PhilHealth enrollment natin. Kasi actually, if you really think about it, this is one benefit na dapat i-avail ng lahat ng tao. Because nobody can say nga, dili ka masakit di ba? And it really does a lot of help in terms of finances. And for our viewers, we'd like to inform you that we will also be inviting PhilHealth very, very soon para your questions also will be answered. And to our viewers also, if you have mga topics na you would want us to discuss here in Dynamic Living, then you are free to text us or phone us in the numbers that are projected in the TV monitors. And we'd like to welcome that. So let's go to the second thrust of the Department of Health. Itong access to quality and effective service. Alam mo, pwede naman na andyan yung service pwede naman na accessible siya. Pero ang problem nato is it quality? Yun di ba? Pwede namang sabihin natin na available siya, pero saan siya? So how can I avail of it? So the first thing is, how can the people access hetong mga quality services na meron tayo?
Actually, Doc, if we would base the previous years, we can say that there is really a problem with our services, especially in our public hospitals and in RHUs. That's why one of our trusts is called the Health Facility Enhancement Program, wherein the DOH has given funding or given assistance to the local government in terms of construction, if there is no barangay health centers in the faraway places, and also repair of the hospitals of the public hospitals, no, the retained and the LGU hospitals.
Ang problem mo kasi niyan, Dr. Cynthia, actually, Dr. Cheryl, alam mo, ang problem kasi natin here, it will actually depend, kasi naka-devolve tayo It all depends on the priority of the incumbents, di ba? So, running the place. So, pag sinabi mo na you are helping the LGUs, especially in the maintenance, in the repair, and maybe in the construction. So, kasi everybody knows nga, there are actually moves na gustong i-privatize natin yung ating mga government institutions, which again, has come out in the open. And yet, parang lately, they are also saying na dili na siya madayon, no? It's not going to be. A classic example is the orthopedic hospital, di ba? Ang NOH. So, they wanted to privatize that, and now they are saying na hindi na. They will just try to enhance it. So, itong sinasabi niyong enhancement, this is applicable to all government institutions.
Yes, actually in Region 10, no, we have been giving assistance, and in 2014, the Department of Health, the Region 10, has allocated almost 732 millions for all the hospitals
In Region 10?
Region 10. Provinces, in
Kasama
the 5
na
provinces. Kasama na yung mga health centers.
Pero do you think na kasya yun, yung sinasabi ninyong 700 million na i-allocate ninyo? Kaya look at there's a growing need, one. Number two, times have changed. So even na lang sa mga gamit natin, marami na din yan. And let's face it, dumadami din yung may sakit na pumupunta sa ating mga government institutions. Yes.
Actually, ma'am, it's not for this year yung lahat na pera for the improvement and construction. These are by batches and by phases. Yung certain hospital na nangailangan ng malaking amount, that would not be granted for 1 year.
It has to be
Ibang
done
phases.
in stages
Oo.
para maka-avail sila
Sa
niyan.
lahat, oo.
So, would you say na hetong mga barangay, let's talk, kasi syempre yung mga regional hospitals, nandiyan na yan talaga sila. Kumbaga, napakaganda na ng kanilang mga policies in order for them to be able to give the services. Kumbaga, mas equipped din yan sila, no? And in terms of manpower, in terms of mga gamit. Now, let's go to the barangay health level. Kasi I think yun yung pinaka-problem natin. Would you say na sa Region 10 alone, lahat ng ating mga barangays, meron na sila mga health units nila? Who would like to? Yes, ma'am.
Okay. I think na parang hindi lahat, pero most of the barangay health stations in the different provinces and cities, no, talagang meron silang allocation for the improvement of their facility. Kaya na nakita na natin ngayon na parang meron ng pagkakaiba. Sabi ng mga pasyente, sabi nila, uy, ang ganda na, para ng parang
Private na siya.
Private na siya na clinic. Kasi makita mo ang before and after ngayon. So the impact now is that the Department of Health is trying to enhance the facility in order to make access nga yung mga clients natin pupunta talaga, because the purpose there is we are trying to improve the facility para naman we can provide quality healthcare. And then not only the facility itself, but
Manpower.
it is also the equipments, no?
What about the manpower also? Yung manpower nila.
Okay. Sa manpower naman, what we can assist the devolved health workers are the trainings that the Department of Health can provide, especially for the management of certain disease. Di ba, dynamic naman every time mayroong changes na ito na ang in ngayon sa pag-manage. So they are being called by our office to attend the training in different programs. Lahat kami nakaprovide ng capability or capacity building ng health workers. Other than that, we have also the deployment program. Kasi yung pag-devolve, kung mag-retire na, usually, in fairness, some other LGUs na talagang committed to health, merong iba nga nag-retire, hindi na ma-replacean. So what the national office is, nag-deploy kami ng mga midwives. And this will be assigned to the JIDA or geographically isolated, depressed areas or far-flung areas, doon sila ma-assign just to make people can have access to health services rather
Alam
than
mo,
at
yeah, kasi
poblasyon.
importante kasi yan, ma'am, na these people, lalo na yung mga kapatid natin in the far-flung areas, na they would have somewhere to go to. Kasi parang it's gonna be a cycle of events eh. If they're seen early on, prevention is there, and early management, they can be referred, so a life can be saved eh, di ba? O, kaysa naman na hintayin natin na maglala yung pasyente, dediretso na siya ngayon doon sa ating pinaka-provincial health center, only to find na punong-puno naman yon. And it is one way of decongesting ang ating mga big hospitals. Yes. Dr. Yeah, ma'am, would you like to add on that?
So actually, ma'am, meron naman kaming mga referral system within the interlocal health zone. Kasi yung lahat, baka what you know is the district system. Ngayon, sa devolution, interlocal health zone. Now, each interlocal health zone, we have a referral center, usually the district hospitals. That's why when a patient coming from the barangay, that would be taken care of the midwife. And then we have some management protocol that this case cannot be handled by the midwife. This will be referred to the municipal health
So
office.
lahat ba ng nagmaman sa ating mga barangay health units or mga rural health units are midwives?
Not all.
Not
Sa
all.
main health center, we have doctor, nurse, midwife. But sa BHS, Barangay Health Station, talagang
Midwives ang and they're trained, di ba?
Yeah, they're
to
trained.
detect kung ano yung kaya nilang gawin at kung ano yung pwede nilang dapat idalhin
Yeah,
doon.
they are trained for that.
So, paano po yun? Would you say na the people are also aware nga, they can always go to these barangay health stations kasi they will be taken care of? Kasi part ng ating program should be dissemination of information. Education yan eh. Kasi kahit na nandyan pa yung ating barangay health station, kung hindi naman aware yung mga tao, yes.
Okay, so in the barangay health station level, sa pinaka-babang level ng isang munisipyo, meron tayong tinatawag na partner natin, yung barangay health worker or the mga volunteers. Sila yung gumagawa ng dissemination and to motivate all the people living there to access the privileges that is being offered by the Department of Health. So we are our partners. So nagtulong-tulungan yan, no? From the different agency at the different level doon sa baba is meron tayong yung sinabi ni Cynthia kanina, yung referral system. Yung galing ng barangay health station, i-refer yan doon sa rural health unit o tinatawag nating RHU. So from the RHU, i-manage yun because we have also the theme there, the doctor, the nurses, midwives.
Tapos
and
meron silang facility talaga
yeah,
to
they have
handle,
their facility
diba?
to
Basic
handle.
needs.
Okay, so the basic services. So kung hindi ma-manage doon, yun ang sinasabi ni Cynthia kanina na meron tayong referral facility
Pupunta na
in
ngayon sa
every
higher.
local health zone para i-refer doon.
Okay,
So-
yes.
In addition to that, under our present administration, we are really helping the indigent on where to go. So we have the CHT team or the community health team. They are called the navigators. They will be the one, they are trained by the Department of Health on to identify kung saan dadalhin yung pasyente sa
Yes.
health center ba ng barangay health station o doon ba sa municipal health office or sa hospital.
Maganda yan, Doktora. Kasi alam mo bakit? Yung sinasabi niyong navigator, alam niyo kung bakit? Kasi the more delayed the giving of what the patient needs may also entail his safety, di ba? So if you have navigators like that, at least it will facilitate further. So kumbaga mas madali siya ilipat kung saan siya dapat dalhin. You know that dapat our schools also should help in this, di ba? I mean, like for example, the State University of the Philippines, yung kanilang public health nila doon, they send out their students on their 4th year to go to the barangay, community immersion, and they really help the barangay health workers. So they get to have first-hand information and knowledge on how to do it. Yes.
Actually, ma'am, the community health teams is in answer to the Millennium Development Goals. Because you notice na we have for health, we are in focus on 4, 5, and 6. And then for maternal death, this navigator will have some checklist. They have to visit and they catering 10 to 20 households. That would be their focus of service. Oh,
So
ganon.
napakaganda nun, no? So what about in terms of budget allocation? Do you think na, heto kasi, you have effective service delivery, improvement of quality care, and that will also include the structures and everything. Would you say, ma'am, na yung budget allocated to the Department of Health is just right or tama lang siya para magawa ninyo kung ano yung dapat ninyong gawin?
Actually, ma'am, out of the budget, kay 2014, we have 1.6 trillion budget, di ba? And then for health, it's 2.0052.
Million.
Oo, that is equivalent to 4 billion.
Okay.
Okay. And then for the regional office.
For
we
the
have-
regional lang.
Oo. Then the regional office, out of that amount, we have only 83 million.
Napakaliit, ano? Considering
Oo.
napakalaki ng Region 10.
Oo.
Ha? Yung sinasasakupan ng Region 10 is really huge. So, would then, how do you, how does the Department of Health locally try to augment yung maliit na budget na binibigay sa inyo?
Ay, excuse me, 83 billion pala, ma'am.
Okay.
But out of our work and financial plan and operational plan, what we need 169 million.
So, how do you intend to augment this? Yung pagka-deficit ng binibigay sa inyo?
Hopefully, yung syntax, remember?
Aha.
Oo.
So, doon
Diba,
pupunta,
yun,
magbibigay.
The promise is yung, ano yan?
A portion of that,
makita
yes,
ng syntax.
ng syntax will be given to the Department of
and then,
Health.
according to our secretary, that would be used for the enrollment of our indigent quintile 1 and 2.
Ayan, so napakaganda naman na pala ng program na yan, no? So, what about our hospitals? Let's talk about comparing our hospitals now with national. Would you say na sa Region 10 ang ating mga hospitals, ang ating mga centers are, would you say at par na rin tayo sa national level? Sige, who would like to answer that?
Actually, we are beginning, no? Because the aim really of the Department of Health is to improve because nakikita naman natin na noon, pero there is an improvement. We are not competing with the private, but then we just want that the poor also would go to our hospital. Hindi sila nagpunta doon kasi wala na silang pera, but then they believe na doon sa hospital makukuha nila ang quality service.
Alam mo,
na
yan
gusto
yung
nila.
gusto kong i-drive at na dapat ang mentality ng mga tao, that there should be a change in the way people think na pag sinabi mong government yan or public, hindi dapat nasasabihin na you go there and you die there. O kaya naman, napupunta ka lang doon kasi walang-wala ka. O kaya naman sabihin nila na porket mahirap lang kami, heto lang ang pwedeng ibigay ng government. So there should be a total change in the outlook towards our institutions, di ba? Yes.
Parang gusto ko yung i-advocate ng yung behavior
Yes.
na yung mga pamilya natin na sana hindi silang punta ng private muna, then pag wala ng pera, lilipat sa government. Kasi I think you believe,
Yes.
Doc, na yung mga doctors natin nagiging consultant, but residency training come from
From
the government
Yes.
institution, di ba?
Uh-huh.
Kasi ang daming cases. Kaya lang, dito sa atin, yung Northern Mindanao Medical Center, although level 4 na siya as to service, tinan mo natin, maliit talaga yung space. What is happening now is, the expansion is upward.
Hindi siya,
Oo, kasi yung lahat na nakuha ng Department of Health is ganun
Maliit
talaga.
lang.
O, ubos na. Oo.
Maximize na talaga siya kung baga. Anyways, ang importante naman even with our government institutions, the services are there. Di ba?
Yes.
Number 2, you have competent people there who will be handling you. Number 3, the services is also quality and standard. Kasi, syempre, nasasakamay niyo rin naman ang licensing and standardization. Di ba? Hindi naman po pwede, doktora, na yung inyong standard for the private is different for the government. Di ba? Isa lang yan. Yes.
Lalo na ma'am, ISO na kami ngayon.
Yes. ISO na kayo. So lahat ng lahat ng gagawin ng DOH is kailangan ISO din.
Standard, oo.
Ang standard.
Next is the hospitals na, retained hospitals.
Yes,
for
so
this
napakaganda niya, no? That's good news for all of us, knowing na with ISO coming in, that means na lahat ng services natin will really go higher than what we have right now. Please stay tuned. We'll return after a short break.
Channel is sponsored by the World Seventh-day Adventist Church. We believe in being people of the Word, people of prayer, people of deep study of the prophetic writings, people who love Jesus Christ, people who keep all the 10 Commandments, people who are compassionate, who respect others, the community and world needs, people who live healthfully by avoiding tobacco, alcohol, unclean meats, drugs and immorality. We believe in joy. We invite you to be a person of hope. Hope broadcasts everywhere in the world with 10 global channels and is affiliated with more than 50 production studios on 6 continents. The result? Hope Channel provides a diverse programming mix in many of the world's major languages. Hope is more than great television. It's a donor-supported ministry that's part of an international family of educational institutions, churches, retail outlets and hospitals. Welcome to Hope Channel.
Tinuod si Jesus mubalik sa dili madugay. Og 80 milyones ka makatawhan sa tibuok Pilipinas ang kinahanglan masayod niini.
O 80 milyones sulod sa 7,000 kapin ka mga isla? Posible ka kini?
Mauna kini ang panahon nga mag-usa ang katawhan sa Dios.
Aron ihatod ang mensahe sa kaluwasan sa tanang suok sa nasod sa Pilipinas.
Pinaagi sa imo og sa akong Kristohanong impluensya sa uban.
Inabanan sa gahom sa Dios. Isip usa ka pamilya nga nagadala sa puwersa sa kamatuoran, walay imposible.
Ang Diyos mismo magasiguro nga kining iyang buhat matapos gayod.
Ang Hope Channel Philippines usa sa pinakamaayo nga galimiton sa Dios. Aron ang mensahe sa kaluwasan mahimong mas madali, mahatod ngadto sa mga katawhan.
Pinaagi sa internet,
pinaagi sa radio,
ug labi na gayud pinaagi sa telebisyon.
Ang inyong mga pag-ampo.
Inubanan sa inyong mga gasa, magamay man kini kun madako.
Sa kamot sa Dios bililhon kini,
nga makadala og dakong kausaban sa kinabuhi sa tanan.
Diha sa bulaton sa Dios, ang tanang kalambuan mahimong posible.
Kita nagatuo nga ania kanato ang matuod nga mensahe sa kamatuoran.
Pinaagi sa Hope Channel, mas madaling makabot nato ang kadaugan sa pagmensahe.
Apan ang kalambuan ini nga buhat, nagadepende kanimo og kanako.
Isip nga sakop niining panimalay sa Dios,
nga nagabaton sa kamatuoran nga pinasikat sa balaang kasulatan.
Ikaw ug ako kabahin ini nga buhat.
Kita nga piniling henerasyon, ang salin nga katawhan,
mga magbubuhat nga ang tumungog tuyo mo ang pagsangyaw sa mayong balita.
Nga ang Dios gugma ug siya mo anhi pag-usab sa dili madugay.
Ang Hope Channel Philippines mao ang modernong pamaagi sa pag-ibanghilyo nining atong moderno nga panahon.
ayaw jud ninyong sipyata sa pag-apil ni ining balaan nga buluhaton.
Himua ang imong kaugalingon ug ang imong panimalay nga tipik ni ining talagsaon nga pagministeryo.
Kaming mga magbubuhat sa South Philippine Union Conference, mag-auhag o magapadasig kaninyong tanan nga makaigsuonan nga
Welcome back to Dynamic Living the Total You with our episode DOHR Health Vision 2014. So punta na tayo ngayon sa isa namang thrust ng Department of Health, which is the Millennium Development Goals. Ang isa sa mga MDG na ano ng WHO, no, World Health Organization, is actually eradication of poverty. Diba? So yun yung isa sa ano nila. And we also know na ang Department of Health has the RN Heals program. Ano ito ang RN Heals na program na to?
Actually, ma'am, it was an answer. Diba, marong ang daming nurses sa Pilipinas na walang trabaho. To the extent that they are now in the
call centers, naging sales clerk.
So, ang competencies na gain during their student days, hindi nagamit. So, good for the administration kasi it started from DOLE.
Okay.
Yung, diba, yung nurse project. Then, because it was technically more on health, it was transferred to the Department of Health. Then we have now batch 1, 2, 3, 4. Now, batch 5. It's now called Nurses Deployment Project. And they are not a trainee con deployment just like before, but a 1-year employment.
So matagal. 1 year.
1
Tapos
year
salaried
employment.
sila, di ba?
Salary renewable every 6 months.
Yeah,
Doc.
and compensated sila, di ba? Oo.
They're not receiving 18,500 something per annum, but they have to be deducted withholding tax.
Of course, expected
ganun
yan.
ang the usual deduction.
The usual, oo. Pero at least they gain experience, and number 2, they're able to give the services na kailangan natin.
Yeah, they are now like public health nurse now 1.
Okay.
So they will be assigned to different barangays together with the midwives. So tandem sila for...
So ano to, ma'am? Ongoing pa ito na program?
Maybe hopefully hanggang 2016.
Na pwede pa siya. So what trainings do you also give to the barangay health workers para ma-attain natin itong Millennium Development Goal na to? So it's you said kanina kasi it's a continuing program eh. So what are these programs and how often do they go and attend the trainings?
Yun ang ngayon is after devolution, yung concern what the training need of the BSW is not taken care of by the RHU or the Rural Health Unit. So as for example, there's new program to be introduced, then they will be called for a training or on-the-job training. And then for the community integrated management for childhood illness. So our BHWs are now trained to handle and to teach mother how to count breaths, whether more than 50, whether they're cut off for breathing, where you can consider that's pneumonia, severe pneumonia or dehydration, whatever.
So
they're being taught to that.
So kumbaga, it's a trickle-down effect kasi tinitrain yung inyong mga BHWs natin, yung mga health workers natin, and they in turn also teach the parents, at saka yung mga magulang, yung mga mothers, no? Isa yun kailangan kasama natin yung mga magulang yan. Which brings me to the next question na how involved should the citizens of this country be in terms of, their health? Dapat ba ang Department of Health lang ang may problema para ibigay sa kanila ang health services na kailangan nila? Or sila din dapat, meron din silang tungkulin sa sarili nila? Yes, ma'am.
Actually, gusto kong sasabihin sa lahat na health is not the responsibility of the Department of Health per se, but health is our own right and responsibility.
Okay.
Kasarili natin yan eh. Kaya we are also trying to motivate all the mothers and all the people in this country to be responsible of their health. And then the Department of Health role, including the health staff, are trying to advocate, motivate everyone to be healthy and to keep their family healthy, and then we will try to motivate them what are the main reason or the causes of illness. Kasi dapat malaman nila bakit sila nakasakit, ano bang dahilan.
At saka siguro maganda din yung sakasali doon sa kanilang information na lalo na sa barangay levels at saka yung sa mga far-flung barrios na paano i-boil yung tubig, paano yung maghugas ng kamay, paano dapat yung mga basic, di ba? Kasi doon nagsa-start lahat yan eh. So, hetong reduction of child mortality at saka sinabi nating maternal health care. Kasama dito, di ba alam natin na meron tayong epidemic ngayon ng measles. So, paano yung mga vaccinations nila?
Actually, yung when devolution started, to tell you the truth, bumaba yung fully immunized child namin. Kasi yung sa Department of Health, we're aiming 95% ng mga bata will be fully immunized. Although ngayon, tumataas na kaunti, yung fully immunized.
Libre po ba itong mga vaccines na to?
Yeah, libre lahat.
Libre lahat yan.
Libre
so how come, what's the problem? Bakit hindi pa natin ma-immunize halos lahat? Considering na libre man kaya ito. It's already given eh.
Yung isang concern na kita namin is, during the national pang mga health workers, we conduct immunization every Wednesday. Ngayon,
kung sino na lang ang pupunta? Ganun
hindi naman masyado ganun. Mayroon nang once every one Wednesday in a month, and rarely they go to periphery.
So kailangan talaga
kasi wala naman sa traveling expense to.
Oo.
Pagpunta ng periphery and outreach
Kasi like
Konti na
ngayon,
lang.
grabe ang epidemic natin sa measles. And
Oo,
measles
especially sa
is
NCR.
one preventable illness. And then hindi naman problema ang measles per se, kundi yung complications noon, di ba? So doon tayo magkakaano. What about in terms of yung prenatal health care ng mga mothers? Kasi we want to prevent maternal, death, mortality. So heto namang prenatal check-up nila, available naman ito.
Actually, yes. And then, we encourage the facility-based deliveries na doon talaga sila manganganak sa health center at to be handled by a skilled worker. So, pagsasabihin natin ng skilled worker, doctor, nurse, at saka midwife lang. Hindi kasali ang hilot. So, we are discouraging now that the hilot will be the one to handle deliveries. So,
Kasi hindi nila alam minsan yung mga complications, di ba? At saka trained naman talaga yung ating mga midwives and the nurses to deliver in babies, no? So let's go now to the licensing and regulation. Etong isa sa mga problem natin, etong mga naglilipana na mga supplements, and they always put their no therapeutic claim. So yun yung mga natin. That's under the Department of Health.
Yes, that is under the FDA or the Food and Drug. So that is really a big problem now because even some doctors are endorsing the food supplements. So what we do, we could not really get all the samples, but we got to have a random sampling of this food supplement and then we send it to the central office, the FDA,
pero
for analysis.
Pag sinabi niyo po na nagra-random sampling kayo, hindi po ba the other way around dapat ito na before nila ilabas yung product nila, pupunta muna sa inyo for approval para paglabas noon safe talaga yung mga magte-take noon?
Yes, they have supposed to bring it, to have a license to operate and also by product registration. So, yung inilagay nila talaga lang is food supplement. So,
para hindi na sa dumaan sa inyo. Ganun ba yun?
Hindi, ano pa din, dapat daan pa din sila. Kailangan talaga yung LTO, pag may LTO number dyan sa label ng food supplement.
Ibig sabihin dumaan sa inyo
Dumaan
yan?
sa amin yan. At saka may product registration, dumaan yan sa...
So, let's face it, magaling talaga ang mga Pinoy to go around and about. No? Diyan talaga tayo magaling. Pero let's talk about it in a serious tone na kung baga, it's the people that will be taking it in. Sila naman yung mai-endanger doon. Is there such a thing as you're supposed to regulate this? Do you really have the teeth to implement your regulation? Or hanggang regulation lang kayo pero you have no way by which you can implement talaga what the regulation is all about? Kasi siguro yan yung problema na kumbaga you have all the policies there, you have all the regulations, and yet you have the monitoring, and yet pagka they violate that, you can do nothing about it. Wala kayong police capacity, in other words.
Actually, in the region, we don't really have the capacity, but we recommend to the central office, and they will be the one to issue if it is violative, the disease and cease order.
So, dun pa.
So, kaya lang, hindi namin ma-monitor lahat-lahat because in Region 10, we have only 3 FDROs left because of the retirement.
So hindi pa na-fill up yun?
Hindi pa because of the rationalization plan. And hopefully, maybe this year, if the rationalization plan will be implemented, ma-fill up na yun. So, wala tayong FDRO na sa Bukidnon, Camiguin, and also Misok. So, nag-team
so
lang
ngayon,
sila.
ang nangyayari ngayon, naglilipana na sila lahat kasi wala na.
Hindi naman. May may schedule naman kami ng monitoring.
Paano yung mga fly-by-nights? Na mga di ba may mga operators ng fly-by-night, we call them, kasi yung mga gamot, yung mga hindi naman nakakaano talaga. So, paano yun? What's the of the Department of Health here? Ano din kayo? Kumbaga, more of recommendatory lang din kayo?
Yan, dito sa region. Ipapadala talaga doon sa central office sa FDA. So, pag yun, na-analyze yun na hindi talaga yun, so magpapadala sila dito ng order. Kasi lahat ng mga guidelines, lahat ng mga memo, advisory is galing sa central office.
Let's answer questions from our viewers. Naabay mga free treatment nga giplano sa DOH for cancer patients? Free medication siguro.
Unless you are a PhilHealth member, you can avail of the Plan Z.
Kung PhilHealth member. pero kailangan PhilHealth member
PhilHealth
siya.
member siya.
Oo, pero meron yata ding criteria yan before sila makapasok sa package Z,
And then,
diba?
as yung nalaman namin is, you should be admitted to the government hospital.
So dapat doon siya. Okay? Approved ba sa DOH ang mga alternative treatments? Unsa may view sa department regarding sa mga alternative doctors din? Who would like to answer this?
Ayun part yun ng traditional medicine. We have one bureau nga in charge dyan, and we have PITAC, and then it's headed by a certain physician. And then, alternative medicine, marami namang nagamit dyan.
So kumbaga, the DOH does not really say na hindi po pwede ang alternative treatment. Walang stand na ganun.
We have the program for the traditional treatment, but then we are more on the herbal that is recommended by the Department of Health, the lagundi.
Pero heto, it went through the regulation talaga.
Yes.
Pinag-aralan ito inano. Okay? Meron dito, daghan na karon mga food supplements nga makaayo daw sa cancer. Is this proven sa BFAD?
Food supplement. So, ang ila lang gibutang diha, if it is food supplement, no therapeutic value. So, hindi yan proven sa... wala.
Okay. Next question. Ang NMMC ba is managed and administered by the Department of Health? Yes, okay. I am a registered nurse. Wala pa ko'y trabaho. Nabay program ang government for the medical professionals?
Okay. You're welcome to apply for the next year batch. Usually, we accept application October. Then we will have the examination, written exam by December, and then interview by December again. Hopefully, you'll be deployed by the second day of January.
So, saan po sila pupunta sa Department
In
of
our
Health?
office, look for Miss Karni.
Okay. Ga-approve ba does the Department of Health approve reproductive health?
We're very much supportive to the reproductive health.
Okay.
Of course, yes na yes.
Yes, of course. Oo. Nga nung dili man pwede mabawal sa DOH ang pagpanigarilyo o ang pagbaligya ani. Siguro panigarilyo sa public spaces siguro. Oo. Yes.
We have no smoking advocacies, 'di ba? May mga mga area nga smoke free, like for example hinguog ba? Talisayan. So, we are advocating no smoking or smoke-free places. Okay,
Dr. Gay, yes. Okay, from Andy, unsa may panglantaw sa DOH sa mga food supplements? Daghan naman gyud kaayo nag-exist karon ani. By organs na nga okay? Ngumingiti na lang taga Department of Health. Ayaw nila magsalita. Ang mga approved ba nga mga diet tablets ug tea, sigurado ba gyud nga safe imnon? Ala ka. Under gihapon ni sa BFAD. Sige, who wants to answer this?
Actually, pag diet tabs?
Yeah, diet tablets, mga herbal teas.
So, as I have said, ang gibutang lang gid nila is no therapeutic values, di ba? So, supplement lang gid siya. So, ang ato lang mo ko na siya lot number, LTO number and product registration. That is not conclusive that it is therapeutic because food supplement.
It just means na safe siya to be taken as a supplement. Okay, no therapeutic claims. Always, ha? Okay, now akong pangutana sa inyong tulo would be, what are the challenges that you think the Department of Health is faced with? You personally, what are the challenges that you have now in the Department of Health as a worker na you think should be answered by 2014? Yeah. Challenges.
Maraming challenges.
Okay.
Yes, especially this 2014, ang dami.
Okay.
When we open up kanina is that we mentioned about the 3 divisions. And among the 3 divisions, yung the Local Health Support Division, yun ang pinakamalaking division.
At pinakamaraming trabaho.
Maraming trabaho, pinakamaraming technical kasi. So yung mga nakalagay doon sa inside the division is that mga program manager bringing all the flagship program of the Department of Health. So, lahat kami doon is meron kaming programa dinalala. Like for example, for myself, I belong to the local health support division under the non-communicable cluster.
Opo, kasi napakadami din yan eh. And we will invite you again to discuss that kasi yan na yung number 1 killer ngayon.
Yes.
Non-communicable na talaga ngayon.
Yeah, number 1 talaga siya. Especially sa lifestyle-related diseases.
So, dapat iimbitahin ka namin ulit, Ma'am Carmen, ha, para dyan. Now, napakabilis po ng oras ko dito sa Dynamic Living The Total You. We'll have another segment for the Department of Health kasi alam ko po na marami tayong matututunan sa kanila. I'd like to thank each one of them and invite them to say something to inspire our viewers. We'll start off with Ma'am Cynthia Descallar. Yes, please.
Okay, so ang dali ng oras, ano?
Yes.
Akala ko hindi pa nag-isang oras. But anyway, we hope that you enjoyed listening to our views, our programs at the Department of Health, and hopefully we can help you. Please try to visit our office, then look for us, and maybe anybody from the Department of Health, they are willing to help you.
At saka napaka-accommodating ng mga tao sa Department of Health. Ako, I drop by there every so often, no? Mula sa pinaka-mababang nagtatrabaho doon hanggang sa pinakataas, they're so accommodating. Yes, Ma'am Ma'am Carmen.
Ang masasabi ko lang is, dapat tayo alagaan natin ang sarili natin. Kung nag-aalaga man, if you're a woman, and then nag-aalaga ka sa family mo, husband, wife, children, mga parents, dapat din, huwag mo kalimutan na ikaw din, alagaan mo ang sarili mo.
Yes.
Because walang nang iba, ikaw lang yon.
Yes. At saka iimbitahin natin sila ulit para doon sa non-communicable na yan. And Doctor?
First of all, a very big thanks to this
Dynamic
Living. Of course, sa iyo, Doc, for inviting us here. And isa lang ang masasabi ko, no, that we must always use our right, no, because health is a basic human right, no, just like in election, we want our right to vote. So, dapat tayo, we would also really want a right, no, fight for the health right. So, and we also remember that health is wealth.
Okay.
Thank you.
Hindi po pwede na iasa lang natin sa Department of Health ang ating kalusugan because it takes one to make one, no? And Winston Churchill actually said, healthy citizens are the greatest assets any country can have. What we are is actually who we are. Let me rephrase that. Who we are is actually God's gift to us. We are created humans to take care of our health, and what we become and what we make of ourselves is our gift to ourselves and to our Creator. Together with the Hope Team, this is Dr. Jean thanking you for another dynamic evening. Magandang gabi po sa inyong lahat.
There is a time for everything, and a season for every activity under heaven. A time to be born and a time to die. A time to plant and a time to uproot. A time to kill and a time to heal. A time to break down and a time to build up. A time to cry and a time to laugh. A time to mourn and a time to dance. A time to scatter and a time to gather. A time to embrace and a time to refrain, a time to win and a time to lose, a time to keep and a time to throw away, a time to tear and a time to mend, a time to be silent and a time to speak, a time to love and a time to hate, a time for war and a time for peace. A time for hope.